Vaccinations continues to be your #1 youth current affairs show. Siyazi ukuthi ke seniyanethezeka since it's now festive season officially, right, Jackie? But we continue with very important conversations on the show namhlanje as we are asking, should vaccines be made mandatory? Now, in light of this new variant that was discovered, it's very important that we stay safe, Mundomusha, and of course continue to hear these conversations. The first stop takes us to Westdean, where we're touching base with a young family who talks to us about how they had to weigh the pros and cons of taking this vaccine. What do you have to say about the conversations that we are having? Namhlanje, do participate in Nkundleni Zethu Zokuxhumana. Let's take you there. Alicia, welcome to Expressions. It's great to have you on the program. So today we are talking about vaccine hesitancy and everything around the conversation goes back to some people who want to do it and some people that don't want to do it. Talk to us about where you're standing right now.
Well, I don't see the need for it, to be honest. At first, we spoke about it in the house because my son just had a heart operation. So I felt I needed to protect him because he wasn't at school for about 6 months. So when we came back, we sanitized the house from top to bottom. No one came in our house, no one touched Hugo, no one spoke to Hugo. I was with Hugo in the room alone. If food had to bring to us, my husband would leave it in front of the door, we'll take the tray, and that's how we lived. So I felt it's like you're in prison in your own home. So we kept him away from school, and I felt, let's have the vaccine. But now with the new strand and going through all the research and things, it doesn't really cover the new strand. So why would you take the vaccine in the first place?
But I heard that the research is still underway to ascertain whether or not it covers this. Do you think if you had a certain level of an understanding in terms of what it covers, you'd be in a better position to make the call?
No. None, I wouldn't, because I've got high medication that I'm using every day. So if that has to affect my health, I don't think I want to go that way.
Do you feel if you had more information in terms of the vaccine itself, you would be likely to consider taking the vaccine?
I'd like to read on what is the pros, what is the cons, because I don't want to go and have the shot and then another booster shot, and then because now you're hearing about a booster shot that you need to take, so they're confusing you. There's a Johnson & Johnson, there's another, the Pfizer, so you don't really know which one.
So there are talks now on having vaccine mandates, which ultimately means that you would have to be vaccinated in order to access certain opportunities in certain spaces. I want to know, how do you feel about that?
If I need to be away from certain places where I need the vaccine certificate, like they call it now. So you have to have your certificate if you have to travel or you have to go into certain spaces. I'm not comfortable with the vaccine, and then I'd rather stay at home. A few family members had it and they isolated, they looked after themselves, and they went perfectly out with it. To the point that I told you, when I had it, a doctor told me, you can have the medication, go home and treat yourself. Go into the hospital. I don't know if you're going to make it out of the hospital. So if a doctor tells you that, how would you feel? Certainly, I would take the medication, whatever medication, which was vitamins. Most was vitamins. And I was fine in the house. I isolated and I had my vitamins and everything was fine, because we travel a lot. Like last year, we had to go to Brazil because the year before we went to Ireland. And then with the thing that we had to find out that we had to take the vaccine to go and travel, we cancelled all our flights. So everything was cancelled because we just felt that there's pros and cons with this vaccine. And when you read most of the cons, it's not what you are.
Now, you're speaking about being an avid traveler. You guys travel a lot. And right now, the international community in particular has moved towards saying, look, you're going to have to get vaccinated or we don't want you in our country. So how is that going to work? So you're going to have to cut on your traveling.
That's what I said. Then we'll travel in our house. We'll stay in South Africa and that's it. but I'm not keen with the vaccine at all.
Well, uyizweleke mbukeli we-Expressions. This is where we start the conversations around this very contentious issue yama-vaccine. Ngiyazi ukuthi abaningi benu bathi bazoyithatha, abaningi sebayithathile, abanye bathi definitely not going to take it, and some are just waiting for information. So that's the conversation. What do you have to say about the conversations we having? Are you taking it? Going to take it? Still thinking about it? Please let us know. Enkundleni zethu zokuxhumana. Expressions returns after this.
Welcome back. You're still watching Expressions, your #1 youth current affairs show. We continue to put a spotlight on this issue around mandatory vaccinations. And of course, our poll question is, should it be made mandatory for people in South Africa to actually be vaccinated? Now, I had an opportunity to visit Wits University campus and speak to the SRC president, Ucebo Khumalo, just to find out what is the state of readiness when it comes to Wits universities. Are the students ready to be vaccinated? And of course, on the back of that, Umqo had an opportunity to speak to Vanessa all the way from Pretoria, and this is what went down. A very warm welcome to Expressions. But we just want to find out from you. There's a likelihood that in the near future, there's going to be a mandatory vaccination that is going to be instituted in South Africa. For students on the ground for this university, what is your position? What do you think the impact will be?
We have written our statement and it's out in public. We have said that we do support vaccinations. However, we do not support mandatory vaccinations. And the main issue with currently why it's becoming mandatory, looking at the new variant that has been discovered. If you follow majority of the doctors, for example, I was following Dr. Philip Capel in the US. So they were stating that with the new variant, the possibilities of saying you are protected even if you're vaccinated are not there at all. They are less. They only hope that those that are vaccinated will be safe, probably in terms of them being hospitalized or maybe being transmitted or affected by other disease. So this means that the vaccine is not really working. But obviously, we do not want to then cancel the vaccine total. What we want is that people must be given a choice. We do actually encourage students to vaccinate, but at no point must people be forced. If you look at other countries, how they have managed this is that they've created specific exceptions. If you're saying, I, as Nkosi, I'm refusing to take the vaccine based on religious rights or religious beliefs, we don't know the guarantees of the university granting that exception. And hence, that's why we're saying it's important for even institutions of higher learning, not only VETs, but throughout the country, to go on an education initiative around this, the same way they usually do when they educate people around other disease, HIV and AIDS, when they educate pregnant women, they do this education initiative. We don't know what is the difficulty now with them just going to communities and educate, because they've always done this.
What is your response or your comment around this travel ban and how it impacts international students that attend this university?
The honest truth is that this travel ban on South Africa is uninformed, because if you can check, this variant is also in other European countries, is also in other Asian countries. And they've been actually having these cases as much as now we have it here in South Africa. Others have been here since last year, because in the previous year they were not able to go home because of these travel bans. When the travel bans were uplifted, it was already academic year. So I can imagine for someone spending 2 years not being able to see their parents, their siblings, these are the things that affect majority of young people in these higher institutions of learning, and it is uninformed. And majority of these countries, whether it's in Europe, Middle East or Asia, they need to reconsider their decisions.
And just to be clear, especially to the viewers at home, will Wits University be making vaccinations mandatory for their students?
From what we know, management has said and announced that they are going to ensure that vaccination is mandatory. However, from our view as the SRC, we are saying people must be given a choice. Vaccination must be pro-choice based, in a sense that those that want to vaccinate must vaccinate. However, we do encourage students to actually vaccinate, and we're going to make means to ensure that they have access to the vaccination stations, and we want to encourage government and all institutions of higher learning, from TVET colleges to universities, to actually educate their student populace, because that makes it better. After I got the education, that's when I actually took a decision to vaccinate.
You're still watching Expressions. Namhlanje ke siyabuza ke on the show, should vaccination or vaccines be made mandatory for South Africans? We do know that there are talks around this, but what do young people have to say? Vanessa Wagamokupedi joins us today on the show. So there's a burning topic. Mina ngifuna ukwazi ukuthi, why don't you want to get vaccinated?
Well, it's not a matter of not being vaccinated, but it's about the information and awareness that is being spread out to the people. What is being vaccinated and what happens to your body after you become vaccinated, and what is in these vaccines, and why should I take it? So there is anxiety and fear from the youth and also the community that what does this vaccine does to your body. And what we have seen is that once a person becomes vaccinated, they become sick for a number of times. So making it mandatory is taking away my human right of making a choice, and asking myself, am I really in a democratic country where I can make my own decisions?
So do you feel ukuthi if such information would be made available to you, no mengabe ungeke uzuyike vaccination, but you would consider it?
A vaccine is like small doses of the COVID and giving your body a chance to fight it off, so that when the actual COVID comes, then your body is much more prepared, to fight the COVID. Hence, after being vaccinated, you can get COVID. So I feel like people should be made aware of what being vaccinated is, what it does, the pros and the cons of it, so that we can make an informed decision and not make a decision according to Facebook, WhatsApp, social media, which is like misinformation or miscommunication. So then why would I just go to the clinic to get information? You need to motivate me to actually go there and get vaccinated.
Talks are being had njengamanje around making a vaccination mandatory. Ukuthi bakuphoqe ukuthi uvaccinate in order for you to have access to certain spaces as well as certain opportunities. How does that make you feel?
Here we're talking about life and death, and you need to fully convince me to say we're putting this into your body and this is what it will do. But nothing like that has happened, and that is why you get less than 40% of the population that is vaccinated. And ask, from the whole population of South Africa, how many of those people are literate to go to a website and read this information? What then are you doing to the illiterate population? How are you then informing them about this? And now you come into me and you say you need to forcefully take this. That I feel violated as a person, and like, oh, so I don't have a say about my health, and that is very frightening, to tell you the truth.
Are you planning on getting vaccinated anytime soon or not? Because I know you said you still need to be swayed or convinced or persuaded, but what would lead to you, to think maybe it's now time to get vaccinated, or you're just not even thinking about it at all?
As someone who lives mostly in Pretoria, has information, has a cell phone, access to internet, has a master's degree, I think it is my responsibility to then seek information and read. There's so many rumors about this, that people get vaccinated, they can't have kids anymore. Like, there's so many information out there that is clouding our judgment, and now we cannot even make the correct judgment about our health. Because it's not like we are stubborn and say, whoever dies, dies, It's that thing about, this is my body, and as much as I love it, I want to take care of it in the best way possible, and not just take things because it's a trend and that everybody's doing it.
So at least we're still having important conversations in the midst of the holiday and festive season here, Konalago Expressions. And of course, we continue with this important conversation, Masbuya, as we ask you, Lapekaya, should vaccinations be made mandatory for the country? We're back after this.
So, Mko, I mean, we've discussed a lot. I think we've discussed a lot of very serious issues. And obviously, on today's show, we were talking about mandatory vaccination. And of course, that's a very important topic. But this is our last show for Expressions for 2021. What do you think is probably your favorite episode in Expressions? And I know this is a very hard question to ask. It's a hard question to ask because we love all of our shows. And I think our shows mean so much to us. They're all about significance and impact. But for you, what is the one show that you think sort of stood out a little bit more?
I think I appreciate every show, like you said, but there's this project that SABC eThekwini uyakumbula with the Zungu family who wrote to us about wanting indlu because they didn't have a house in Dlabo Beseneta, they didn't have food. You know, I went there and I interacted with the family before the whole project took flight. And for me, I just thought it was a full circle moment to see the various stakeholders come together. I mean, you were there, I was there, the whole team was there.
We even had SABC big guns there. I mean, our bosses were there, ministers are there. I mean, we definitely pulled out all the stops when it comes to this particular show.
So we have to reflect on this particular moment. If you don't remember Mbogelo Expressions, because we make things happen, take a look.
2019 uma udlulile emhlabeni sasala soda sizingane ubaba wagula uma wadutshula lezi izimpi lezi zakhe akekho umuntu osapota la ekhaya sedlwelelile ingane ezothu kuze kube manje akekho umuntu osebenzayo nje sazama ukupatanisa lokho kuleyo mali engekho leyo mali leyo uzokuphela agcina lapho.
And of course, we got a heartfelt plea from Umdeni Wakazungu, who live in this very same house, who said to us they asked for any sort of assistance. And of course, this sent waves across society where Jackie, Umpagati where Expressions heeded the call and said, we are looking forward to coming to assist. Yakumbula, the house that we showed you a few months ago, was barely in foundation phase. Well, today it's going to be unveiled.
Mam Kiza, we started this journey with you. You were here when it was just mortar on the ground. It was just a small foundation. Today it's a full-fledged home that is going to be, giving dignity to young people. How do you feel having been part of this project, but actually most importantly, coming to the end of what it is and what it looks like today?
To me, seeing an end product, it makes me feel so good. And I want to thank the inmates. If you look at the work that they've done here, I'm an inmate, it's touching. One is saying that people, they can reform. And I'm pleading to everybody that is working out there to give these people an opportunity because they've done a stellar job on this house. And to thank Expressions as well. Because if you look at Expression, we just give them the money and they've accounted for everything that they've done and they've put this beautiful and amazing thing together, which as we are celebrating our 20 years, our first house, it's amazing with so much of stakeholders, and I'm very proud of ourselves and SABC. The fact that they can't always report about strategy, they can also do something that is amazing, empower and give back to the community.
Now, as you do know, Umdeni Wakazungu wasifonela si Expressions, wasibhalela futhi wasicela ukuthi badinga usizo, and now we are here because the help that they so asked for has arrived.
Baleka kakhulu nesigqugquzelayo njengo SABC ukuthi fanele sibe yizwi neindlebe zalabo abadelelekile nalabo abazithola bengatholi ukunakekela nezidingo. So kuthina sithokoza kakhulu ukuthi sikwazile ukuvundulula lolu daba, sakwazi ukuthi sakhuluma sancenca abantu ukuthi balule isandla ukuze kube nomehluko ozokwenzeka. Umndeni wakazungu manje ozwide sebe nendlu, sebe nophahla phezu kwamakhanda abo, bazolala baphephe bafudumale.
Iminishani lento ukuthi niqalile this project from the ground and namhlanje iseyiphelile.
Ngokusuka ngalapho nje16 engolweni. Usilula mawacheleza isibongo. Shothi engize ngikubonge ngizobonga ukubambisana nje nabaphathi. Enteni yonke siyenzile siyiqale nje kuphansi bengekho ngasho ukuthi izogcina konje egcineni.
Uyakhumbula Expressions mayifika la kini eqaleni wawukhala nokukhala. Namhlanje ngibona ngathi ujabulile, ha?
Ngijabule kakhulu ngiyabonga nisincedile angazi ngathini nje akubhuti umziyanda nje mhla ngiqala ukufika naye because ngakubuhlungu ngangathanda ukuyenza ngoba ngangicabanga ukuthi kuzophelela kodwa ngibone ukuthi hayi expression iyasiza nje noma ngamkhize ukuthi naye esincede kakhulu ukuze kulandele naye bojeleke nabo bonke ke noma mbe besincede kodwa nje bwa kakhulu ku SABC kanye nomama mamkhize nejele.
Ngijabule kakhulu ngibonge kumamkhize ngomziyanda nakusipho nawe bhuti ngiyabonga kakhulu nakubaphathi bejele nebosha ngiyabonga kakhulu ngoba besinhlekisa emndenini kakhulukazi.
This is indeed a full circle moment. What we started, we finished. But I think most importantly, Expression is sending a very clear message out there that we actually can be agents of change, especially as young people. And I want to say thank you very much to all the stakeholders, the partners, the collaborators, everybody that was part of this project. And of course, we obviously celebrate and we're so excited for the Zungu family.
So we've come at the end of today's episode and of course the end of the episode for 2021 when it comes to Expressions. It's been a pleasure being in front of your screens, and of course we have to say thank you to this amazing team, this A-team that is Expressions, that continues to put in the hard work and make sure that you as a young person have not only a platform but a voice. I think Expressions more than anything else has sent a very resounding message to say that young people matter, young people are important, but most importantly, young people can make a difference in their communities, right?
Yep, and of course we continue to do this, Ngunyagozai. I think doing this year in, year out, telling a different story, a different perspective through the eyes of Ulushalala Mzansi, I think gives me the most joy about this show. And of course, let's not forget that we lost a soldier, one of our producers of Lunyaga, Umamzanele. We miss you so much.
Love you always.
And of course, thank you, Mundo Mosha, for being our shining beacon of hope as we continue to crisscross the country and tell your stories. Thank you so much for trusting us with all your stories. Thank you so much for this year. Till next year, Salegatli, do take care.
Happy Christmas!